So, good morning, everyone. My name is Sagendra Singh, and the topic of my paper is enhancing healthcare security using IoT enabled with continuous authentication using deep learning. The paper ID being 501. I am the author of this paper. So, let us start with the abstract. The Internet of Things (IoT) has transformed healthcare by providing continuous remote patient health monitoring. Ensuring the security and privacy of patient health data in such IoT-enabled context, on the other hand, is a critical concern. This study proposes a unique method for improving IoT-based healthcare security via continuous authentication, utilizing deep learning, especially the long short-term memory (LSTM) model. The suggested system continually analyzes user behavior and health state, using biometric data to provide seamless and secure authentication. Multiple security credentials, including personal identity number, PIN, password, and biometric identity, are used in the architecture to provide effective protection against unauthorized access attempts. Using Arduino Uno and smart devices, data from a broad array of sensors connected to patients are gathered, and a complete dataset is created for training the LSTM model. The performance of the suggested system is assessed using multiple performance measures, such as accuracy, precision, recall, specificity, and the FN score. The findings show that the model is very accurate and efficient at discriminating between legitimate and unauthorized users. The system consistently outperforms previous research efforts and demonstrating its superiority in predicting authentication answers. So let us start with the introduction. The Internet of Things (IoT) has ushered in a new era of healthcare revolutionizing the way patient health is monitored and managed. IoT-based solutions provide continuous and remote monitoring of essential health indicators, offering real-time data to healthcare professionals and patients for enhanced diagnosis, treatment, and preventative care. Sensors strategically placed in hospitals or even patients' homes gather vital data such as heart rate, blood pressure, blood sugar levels, and body temperature. This information is sent to a central processing unit, often a microcontroller, which allows for smooth communication between monitoring sensors and the cloud server. From there, healthcare experts can access and analyze the data, providing insights and action even from distant places. IoT enabled healthcare systems have shown enormous promise in terms of improving patient outcomes, increasing healthcare delivery efficiency, and decreasing the strain on conventional hospital infrastructure. The architecture of IoT in healthcare sector. Recent advances in healthcare have resulted in widespread of use of IoT-based technologies for continuous patient health monitoring. Sensors are strategically placed in hospitals or patients' homes to monitor vital indicators such as heart rate, blood pressure, blood sugar level, and body temperature. The data is subsequently sent to a microcontroller which serves as the central processing unit for all linked devices. This real-time data transfer is enabled by the IoT ecosystem's seamless connection. The microcontroller security transmits health data to a cloud server through a dependable network connection. This cloud-based architecture acts as a central repository for storing and managing health information for patients. One of the most significant benefits of an IoT-based healthcare monitoring system is the ability of provide remote access to health data. The cloud server works as a conduit between the microcontroller and the smartphone of the patient or authorized healthcare practitioner. The data is encrypted and securely sent, protecting the confidentiality and security of critical health information. Architecture. So, Recent advances in healthcare have resulted in the widespread use of IoT-based technologies for continuous patient health monitoring. Sensors both the doctor and the patients may remotely check the patient's health condition through the smartphone application using secure login credentials. The smartphone app's user-friendly design show data in an understandable way, encouraging patients to be proactive about their health while delivering crucial information to healthcare practitioners for early treatment. This figure 1 depicts the recommended systems architecture which shows the continuous flow of data from sensors to the smartphone. So first, it measures temperature, heart rate, blood pressure, and glucose level. Then it, then it is sent to the microcontroller from the mobile and then to the cloud server. Then from IoT gateways, it selects the registered user and sent to the doctor. Proposed systems. The suggested system design as shown in Figure 2 enables continuous transfer of patient data to the cloud through the microcontroller. To access the information saved in the cloud and system uses multiple security credentials such as personal identification number PIN, password, and biometric identification, guaranteeing that comprehensive security measures are in place. Our suggested system security mechanism is intended to continually monitor the user's physical behavior and health status. The biometric data of the user is transferred to the gateway and authentication score is continually checked throughout login. Factors such as the amount of unsuccessful password tries and the speed with which the data is input are considered. If several anonymous password attempts are detected, the system requests further authentication through one-time password (OTP), security questions, or ocular scans. Each user receives an authentication score based on these characteristics. If the score falls below a specific level, the suggested machine learning method detects unauthorized access attempts. To allow continuous authentication, user data is continually gathered over a specific time period. Scaling, sampling, jittering, permutation, and cropping are used to process the acquired data. The suggested security method is broken into two parts: the user enrollment process and the user verification procedure. The system enables accurate user identification and verification by training the LSTM model using the enrollment and verified data and applying the authentication score. When a user inputs anonymous credentials, the authentication score is impacted, and if it goes below the predefined number, the system issues an alert. The user is instantly alerted through SMS, and the scheme asks the system to re-evaluate the user's authentication. So you can see summary of this paragraph in this figure. So now let's start with result and discussion. In this research, TensorFlow, an open source machine learning framework, is utilized to create a continuous authentication system for IoT enabled healthcare security. The data is collected using Arduino Uno and smart devices, as well as sensor connected to 5 human participants. To continuously record critical health metrics, each participant contributes 10,000 feature vectors, resulting in a massive data set for future research. Sensor reading are pre-processed to ensure data quality, which includes data cleaning, imputation for missing values, and outlier removal. Using feature extraction techniques, the processed data is then utilized to identify relevant patterns and features. The dataset is partitioned into training and validation sets in order to correctly train the LSTM model, which is meant to handle sequential data and long-term dependencies. After training, the model's performance is evaluated using the validation set, and hyperparameters and architecture are adjusted to get the best results. The LSTM model is used by the continuous authentication system, which is implemented in an IoT-enabled healthcare environment to access user input and calculate authentication scores in real time. With continuous updates based on fresh user data, the system learns and improves its authentication accuracy over time, giving a secure and trustworthy solution for IoT-based healthcare monitoring. So the results are as follows: the system consistently performs across all datasets as shown in Figure 4, with an accuracy range of 0.88 to 0.98. The high accuracy ratings, which range from 0.86 to 0.98, demonstrate the system's ability to distinguish between actual users and fake ones with a low number of false positives. Additionally, recall scores between 0.90 and 0.99 demonstrate the system's ability to accurately identify the majority of real people during verification. Specificity scores ranging from 0.85 to 0.96 demonstrate the system's strict security measures against unauthorized access as well as its capacity to decrease false positives. The FN score offers a general assessment of the system's accuracy and effectiveness and is balanced statistics that range from 0.88 to 0.98. Similarly, in the study conducted by WLEE at AL, their authentication model achieved an accuracy of 90%. In contrast, a proposed model again surpasses this benchmark with an accuracy of 92%. This consistent trend of outperforming existing models reaffirms the high accuracy and efficiency of a proposed LSTM-based continuous authentication system. In conclusion, the primary objective of this research was to improve IoT-enabled healthcare security via continuous identification using deep learning, especially the long short-term memory LSTM model. The proposed technique produced positive results, demonstrating that it is a reliable and efficient way for authenticating users in the IoT environment. By including numerous security credentials such as PIN, password, and biometric identity, a proposed model exhibited a high degree of accuracy in distinguishing actual users from unauthorized access attempts. The LSTM architecture's ability to manage sequential and time series data such as user activity and sensor reading was critical in discovering patterns and dependencies that led to more trustworthy authentication options. The continuous authentication technique provides a variety of advantages in addition to ensuring that only authorized personnel could access crucial patient health data and preventing security breaches. Because of its capacity to continuously monitor user behavior in real time, the system can swiftly detect and react to any suspicious action. So, thank you